A long line of ambulances outside a COVID-19 hospital in the state of Gujarat. Inside are patients struggling to breathe and waiting for a bed to become available. Gujarat is one of many states where the hospitals are overcrowded and they don't have enough equipment or healthcare workers to deal with the current caseload.
The ambulances bring in the patients who are on oxygen supply. Some of them are critical and they're admitted first as soon as the beds with ventilators are available. The patients who are on oxygen supply through the Venturi masks are given that in 108 ambulances.
As patients wait for beds, the families of the dead mourn for their loved ones. Nowhere is the situation as bad as in the state of Maharashtra, where migrant workers crowded bus and train terminals after more restrictions were announced. The closing down of all but essential services has seen many daily wage earners lose their jobs. They want to travel to their home states, afraid the government might shut down public transport as it did last year.
It's the common man who suffers the most. I have come here from Uttar Pradesh. I have no ration card or any other local documents. Only those who are local and have a ration card will get groceries. Outsiders don't get anything at all. How will migrant workers feed themselves? That's why they're leaving for their villages.
State leader UDDHAV THACKERAY said he had no choice but to impose the restrictions.
This disease is spreading at a very horrifying pace. I say horrifying because today's number of positive cases in the state is the highest so far.
Maharashtra's 125 million people will only be allowed to go out for work and shop for essential supplies, including groceries and medicines, until the end of April. As India witnesses the world's biggest surge in cases, the Health Ministry says it will fast-track emergency approvals for the Pfizer, Moderna and Johnson & Johnson vaccines. That's amid continuing reports of vaccine shortages in the country, which produces 60% of all the vaccines in the world. Elizabeth Puranam, Al Jazeera, New Delhi.